October is Breast Cancer Awareness Month, and this disease affects 2.3 million women worldwide. That's according to breastcancer.org. And this month is serving as a reminder about the importance of regular screenings and how to take steps to protect our health. So joining us now to speak more about this is Dr. Bonnie Jo, the Chief of Breast Imaging at UCSF. So glad you could make time for us today.
Thank you so much for having me.
I wanted to start with, when should people start screening? I'd always sort of heard 40 years old, but do you think that women should be doing it when they're younger?
Well, for average risk women, definitely 40, and we believe in 40 and annually for screening. This is to promote early detection, give us the best chance of having a good outcome in the worst case scenario where someone may be diagnosed with breast cancer. Now, there are certain populations that need to screen sooner, and these are people who have, for example, a genetic mutation that makes them more susceptible, or if they're just a high-risk patient due to family history. So I would say talk to your doctor, get a risk assessment before age 25 or 30, ideally, and then you'll know when is the best time to start screening. But for sure, everyone should be screening at age 40.
Yes, yeah. The mammogram is one part of it, but what about like getting an ultrasound? Should they also be doing that too?
So we have different ways of detecting cancer. Mammography is definitely the proven method, and that's what we recommend for everybody. Then we may add ultrasound or MRI or other supplemental techniques in a screening setting. A lot of it depends on what's available in your area, what the expertise is, and the supplemental screening is a big conversation that I would say is best had with your doctor or your radiologist. And this is where I take a very personalized approach with each patient. But for sure, want to make sure everyone at least gets a mammogram. So no matter what, mammogram is something everyone should get.
Start
and then
there.
Additional testing.
Yeah,
yes,
start there and then discuss with your doctor whether or not you should have an MRI or any other steps there. How often, even for a woman, should you be doing like a check on yourself?
So we used to say everybody should be doing monthly breast self-exams. Currently, we don't have any strict guidelines on that. I always tell women that it doesn't hurt to be aware of your breasts, and if you get used to knowing what the normal lumpiness is, then you'll be better able to tell when there's something wrong. So bottom line is, if anything feels off or seems of concern or is wrong with your breast, you should just bring it up to your doctor. Don't guess, don't discount a symptom. And then we in breast imaging can help guide you through anything and do our best at early detection or reassurance when appropriate. And so don't ignore symptoms.
Yeah, and also don't be like embarrassed to talk to your doctor. That's literally what you're like there to be doing, is to be having like an open and honest conversation about like what's going on with yourself. And you've been doing this a while, as you're the Chief of Breast Imaging at UCSF. What have you seen as far as once somebody does detect something, and obviously doing it earlier is better, but like then the next steps, like how they get the treatments that there are and the options that people have after maybe they do discover that they might have cancer?
Okay. Well, first off, I should correct. I recently stepped down as chief to move on into the chair's office. So Dr. Khalil is our current chief. But yes, I was chief for a good 17 plus years. Now, in the unfortunate scenario where someone comes in and we do have a diagnosis of cancer, my hope is that they will entrust us to help them be treated, and it's a very treatable disease, so there's many steps involved, and I think the bottom line is it is such a common disease, unfortunately, that you likely know someone who gets impacted, and we can walk you through it. So trust in your physicians and trust in the experts to take care of you. But there's help and there's a lot of support, so don't panic and don't freak out. Just know, come get support and we'll take care of you. And that's what I tell all my patients.
And you do have a walk, a fundraiser coming up. It's the Nova 12 walk on October 25th. It's from 8 to 3 p.m. at Fort Mason. I'm wondering what you're hoping will come out of that walk. I mean, it'll be a lot of people all together at once.
Thank you so much for bringing that up. So Nova 12 SF is something that Robin Lee created and developed, and I have participated in this since inception. This is something we do for our local patients. This is based out of Zuckerberg San Francisco General Hospital. So our at-risk patients who are unfortunately impacted by breast cancer, this walk helps pay for services like taxi rides to your doctor's appointment, or helps to cover rent. It's horrible for someone to be thinking about whether they can get treated for cancer when they have other needs and they have to pick and choose. So we're trying to help these patients that need just a little extra support get the care they need. And we're hoping this also helps raise awareness and gets the community involved. All the funds stay locally, and it's such a great cause. So I hope people will come out and support us or donate. Any and everything helps. And
Nova,
so
that's the Nova 12 walk
Nova
on
12
October 20th.
SF, yes. Thank you.
Dr. Bonnie Jo from UCSF, I'm so glad you could join us. Thank you for your time.